My traditional name is Every, and I belong with the Wolf Clan and I come from Leech Lake. And I just want to welcome everyone to the Expanding Indigenous Health Speaker Series. This series is made possible with funding and support from St. Louis County. This Zoom event will be recorded and you will receive a Zoom notification. That just happened just a few seconds ago. We ask all event attendees to mute your microphone during the Q&A, and then please put any questions that you have in the chat. We will have time later to share these questions with our speaker, and so we'll have a chance to go through those at the end. Before we begin, we always start with an acknowledgement that we are on traditional Indigenous homelands. And tonight I am sitting in Duluth, a city that rests on ceded land that was acquired through the Treaty of 1854 between the United States government and Anishinaabe tribal nations. I'm grateful to be here tonight and grateful to be here with you. Tonight, we are here with Dr. Arne Vainio to learn more about why Indigenous healthcare matters. And I'm going to ask Arne, would you be willing to introduce yourself?
Bonjour, or Anin, Indino Magando. Bangi Yatago Ninata, Ojibwe, and Gaga, Tunjia, Moyan. Dr. Vainio, in addition, Kaz Jaganashimon, Arne Vainio, Indigenous Jaganashimon. When you mean singing down, Mino Yawan at Dunanoki, one equation, a cosmo new Mino in Moshe. Bejigo Janus, Miskubanation, and Cosmicoses. Gadara Botch Tuman and Nishinabe, Mo, Jibabana, Maguk, and Nishinabe, Schwallen. So, by way of introduction, said Anin and Buju are greetings for Ojibwe, and Buju is more of a day-to-day greeting, and I've been told that Anin is more formal and then we use with people that we really respect or haven't seen for a while or just met, and I meant to say I'm Anin. Indinaway Maganadug means my relatives, and there's a humbling statement, Bangi to go into Ojibwe, and Gaga Gujitun Ojibwe Moyan, and that means that I only speak a little bit of Ojibwe, and I'll try to use that now. And even fluent elders will say that. A humbling statement is important, and it brings us to the same level. And that whole I only speak a little bit of Ojibwe, in my case, is true. And but I'm learning. And my Ojibwe name is Ogamabenes. In English, I'm called Dr. Vainio. I live in Duluth. I work on the Fond du Lac Reservation. Owanakwe, Iwu, Ivy is my sweetheart and wife. I get points for that. And that last part, Gada, Bajtuman, and Anishinaabe, Mo, and Jibabanazi, Maguk, and Anishinaabe, Ishitwawan means we do these things to keep our language and our culture alive. And we all do things to do that. And from a medical perspective, I do that. But LeAnn certainly does that at AICHO. Ivy does more good works in the community than any three people I know. And happy to have Becky Nordstrom on here. She does the Zoom things and does it well and has saved us many times. So you can tell by the stethoscope that I'm a physician. You can tell by the glasses that I'm over 40. There's a condition called presbyopia that happens. Your lens behind your pupil gets a little bit not as compliant when you hit 40 and your arms get longer and you keep trying to reach the news, stretch out the newspaper to read it, and finally you have to admit that you need glasses, and that's a 40-ish thing. I have a ponytail. That means something. And I'm wearing a t-shirt, which means I have my day off. And the t-shirt is from Venice Beach, California, which means that occasionally we get to be tourists. And all that stuff is important, and it rolls into who I am and how I treat patients. I put tobacco out for all of us. And even people that see this recorded later. I made it so it's retroactive and it covers everybody. So, so I guess that was a rambling statement of some sort. My pronouns are he, his, and LeAnn. Question? Did you have a question for me to start? I think you're frozen there.
Yeah, I'm really sorry about that. I got kicked out of Zoom for the first time today. I'm sorry. Thank you for that introduction, Arnie. And I guess I'm really interested to hear more about how you became a doctor. Why did you decide to become a doctor, and what was that journey like for you?
Yeah, that's a long and rambling thing. Um, my father committed suicide when I was 4, and we owned a bar, and um, it was called the Good Luck of all things. And my mom ended up raising 7 kids pretty much by herself. And I had a stepfather, but he was an alcoholic lumberjack, and I liked him just fine. But when he was home, it was not a good home life. And so in high school, um, I wasn't really a good student. I got an B honor roll once on a bet, and then just there was no reason to really do that anymore. And but I was a reader. I was a reader from my first memories. I had books and read science fiction. I read pretty much everything that came my way, but science fiction, Ray Bradbury, Isaac Asimov, George R.R. Martin before he got famous, um, and um, and I always knew there was another world out there, even if it was another world, and and I like to work. When I worked, I was a bartender for quite a while, and actually started bartending before I was even old enough to drink. And I was a heavy equipment operator. I got hired to do some manual labor and digging a ditch with a shovel when I was 18 years old, and I was so good at using a shovel, the guy that I was working for let me run a backhoe, and then I just started working construction. Worked in Minnesota, Wisconsin, Montana. Worked in Denver for a while, doing construction, doing piping for the Army Corps of Engineers. Loved every minute of it. And I was 20 years old and was in charge of subcontractors, and some of them didn't like that. I didn't like a 20-year-old native kid being in charge of them, but I loved it. And finally, I wanted to be back home, and I was a partner in a sawmill business, and that wasn't really a very good business, and it was a lot of work and not a lot of money, and stuff broke down all the time, but I liked it. I liked doing it. And then I got a job in a body shop painting trucks and sanding things and sandblasting, and loved every minute of that too, and didn't make very much money. And then there was Edwin Peterson was an elder, my cousin's uncle. He was a good old guy and made moonshine all the time. And we used to net fish illegally and shine deer, and for survival, not for fun. And he was feeding his pigs, and he had a bucket full of stuff. And there were 2 people with him, and he went down, and they didn't know if he had a heart attack or what happened, but they didn't know how to do anything. He didn't have a phone, and somebody had to run a quarter of a mile to call a volunteer ambulance that took 45 minutes to get out there. And all they could do is just look at him, and he died. And I didn't want to be that person, so I was going to take a CPR course, and then I ended up taking a 110-hour EMT, emergency medical technician course. And it was the first time that I was around people that every Wednesday night for 16 weeks or 12 weeks or something, I can't remember. But for a long time, that everybody was just on fire for something, and for doing CPR and airways and masks and pretty basic life support things, no IVs or anything like that. But I loved it. I loved the medicine part of that, and I loved the the way everybody else loved it, and it was like so excited about it. And then when it got done, when the course was done, it was just done. They gave me a piece of paper, and I was an EMT. And then there was an accident when I was working in the body shop. The big trucks got wound up to semi trucks full of logs, got built up speed to climb a big hill, and that was right there was the crossroad, but at the where I worked in the body shop, and I was sanding a truck with a machine sander, and it was noisy, and I felt the impact when that semi hit a pickup truck. And I went out to the intersection. I ran out there, and there was a woman in the truck, and there was logs everywhere. And that truck was that semi was in the ditch, and all the logs were off of it, scattered all over, and the tires were hissing, going flat. And that woman was in the truck, and all the windows were broken out of it, and she was laying on the seat, and her neck was broken. I didn't know that, but her mouth was full of blood, and I cleared all that blood out, and some teeth, and then she was awake, and she was scared, and I just talked to her. I just held her head still and talked to her until the ambulance came, and we got her on a backboard and got her in the ambulance and sent her off. And as she was getting into the ambulance, they tipped the backboard so she could see all that destruction. And then she realized, how bad that accident was. And she just whispered thank you to me. And then I never saw her again. But that got me to apply for a firefighter position on the Virginia Fire Department in Virginia, Minnesota. And I got that position and absolutely loved it. And while I was there, so I was there for 3 years, from 1985 to 1988. And while I was there, the paramedic class started. So paramedic, it was 1,051 hours of training. And so it had firefighter training, and we did all the basic life support stuff. But all of a sudden, we became advanced life support, and we started IVs, and it just did a lot more stuff. And we were busy. And I loved it. And in the 3 years that I was there, we were supposed to switch off driving the ambulance every other. So you drive the ambulance one run, and the next run you're in the back, and then you drive it here in the back. And in the 3 years I was there, I drove the ambulance one time. And I always wanted to be in the back. And when there was a fire, I always wanted to be on the nozzle too, and I got to do that. And that was dangerous and exciting and fun. And I absolutely loved that. But my paramedic instructor and Mark Guier, he was a paramedic from Duluth and came up and taught that class. And he remains one of the best teachers I've ever had. And he lived and breathed paramedic stuff. And there was an accident, and a woman died in that accident. And it was a friend of mine, but it was such a bad accident that I didn't know who she was. And when I found out later, then I kind of wished I would have done something different and done CPR or something, which would have been futile. It wouldn't have changed anything. But then it made me, then I started to doubt myself. I started to think, now that I know who that is, I would treat her differently. And I didn't think I was cut out for being a paramedic and doing medicine. And Mark told me that I was the best paramedic he ever worked with. And we quit our jobs together to go chasing rainbows and go to medical school. And he came from a medical family, so he knew what that meant. And when I graduated high school, I went to UMD and University of Minnesota Duluth. And my classes that I took, nobody in my family had ever been to college. And I wanted everybody up north to know how smart I was to be in college. And I took a calculus class, upper level chemistry class, calculus-based physics class, and I think a biochemistry course. And on the first day, I didn't know what was going on. By the second day, I was totally lost, and I didn't know I could withdraw from classes. And I actually got put on academic probation. End of my second quarter at UMD, my GPA was 0.00. and didn't pass a single class and got put on academic probation. So, so when Mark and I came back to college, I had to make up all that. And, but then we were serious. And Mark and I were the number 1 and 2 students in every class we were in. And it was all upper level science classes and biology classes and embryology classes. And we're the only ones that had ever had the keys to the embryology lab as undergraduates. And we would study for embryology tests. They'd be looking at microscopes, and the instructor would purposely park those needles on, that you had to identify something on the trickiest possible something. And he wouldn't even say, what is this? What is it? He would ask what does it develop into? So you not only had to know that, but you had to know the development of it. And Mark and I would be in before tests, would be in the embryology lab till midnight or 2 o'clock in the morning. Go to our separate homes, sleep for a couple hours, get up and be back in the embryology lab by 5 or 6 o'clock in the morning for tests. And that got me into medical school. And even when I got into medical school, I didn't know what the next steps were. All the other med students would talk about, pathology and, rotations coming up in 3rd and 4th year, and all that stuff was a mystery to me. And everybody seemed to know what that was so much. And I was afraid to ask what those things were because I didn't want to look ignorant, and I didn't want my people to look ignorant. And so medical school was, I loved it, and was a good medical student. Went to the University of Minnesota in my 3rd and 4th years, and down in the cities. And if I could, I did my rotations at the county hospital and at Hennepin County Hospital. And Native patients, when I was a medical student, if I got to do stitches on them or whatever, they were so happy to see a Native physician or a Native medical student that they would sometimes they wouldn't let go of me. And then I went to the Seattle Indian Health Board for my residency, and spent 4 years there and absolutely loved it. My mom had a kidney transplant. She was on dialysis for years, and when I was started medical school, she was on dialysis, and she was on dialysis when I was in college. And in my 3rd year of medical school, I was on a surgery rotation, and kidney came in. Somebody got into a fatal accident, and a kidney became available that matched hers. She was 250 miles from the transplant center, and it was one of the biggest snowstorms of the year. And they called her and said, "We have a kidney for you." At midnight, they called her, and she couldn't even get out of the driveway. And she called her friend Rose Anderson and told her that a kidney came up, and she just have to take the next one. And Rose knew there was no next one, and she said, "You get your coat on." And she took her 4-wheel drive truck and came and got my mom and drove her all the way to the cities. And so my mom got a kidney transplant then. And when I was in residency in Seattle, she was so proud to come out there, and she was just so proud. And she died the night that I graduated from residency, so she didn't get to see me graduate. And that was one of the big things she wanted to do. Ivy and I got married, and when we were in Seattle, we went to Las Vegas and got married. Long story, different story. Nothing went right except for the wedding, and still working like a charm. So from Seattle, I loved the Seattle Indian Health Board, and then they wanted me to stay out there. And before I left, Ruth Myers she was at the medical school in Duluth, and she was Grand Portage Ojibwe, and she held everybody's feet to the fire when it came to education. And she wanted to make sure that people worked for their tribes and came back and worked for their people. And when she made me promise, she was, when I was getting ready to go to Seattle, she was in the hospital. She smoked a lot and she had COPD, and she was in the hospital a bunch. And but she was in the hospital before I left for Seattle, and somebody came and said, Ruth wants to see you. And I didn't want to go see her because I knew that feet to the fire thing was going to happen. And I went in, and she was really weak and coughing. And she said, I heard you're going to Seattle for residency. And I said, yeah, I am. And she said, I want you to promise me you're going to come back and work for your people. And I said, Ruth, my mother is here. She said, that's not good enough. I want you to promise me you will come back and work for your people. And I said, Ruth, everything I love is here. I'm from northern Minnesota. This is my home. She said, that is not good enough. I want you to promise that you'll come back and work for your people. And I said, Ruth, I promise. And when my mom died, the night I graduated from residency, I didn't have any reason to come back. And except for my promise to Ruth, and she'd already died. And the Seattle Indian Health Board knew the name Ruth Meyer because they knew that was the reason I couldn't stay in Seattle. And I've been a physician on the Fond du Lac Reservation for 26 years, and seriously loved every minute of it. I should be a heavy equipment operator, and I am. And you know, there was some luck involved, but there were some people who guided me, and I still think I arrived at being a doctor the same way a pinball gets to its destination. And if there wouldn't have been certain people along the way, it just wouldn't have happened. So that was a long answer to a question, LeAnn. So that's the way those answers are going to go. So if anybody's keeping notes, just write down the last part because it's going to take a while to burn your pencil out.
Thank you for that. That's a beautiful answer. And I have my video off because for some reason I'm having unstable internet tonight, and I'm scared I'm gonna get kicked off again. But building off of that, it was 2 years ago, I was asked to be a community representative on the School of Medicine, UMD's School of Medicine admission committee. And I spent what they call a season from like September until March on the committee, and we were tasked with reviewing applications, medical school applications, and then conducting interviews, and then being part of a committee that made some decisions. And so I'm curious about, from your point of view, like, what would you say to community members who maybe think that maybe might count themselves out, for going to medical school or into healthcare, or what would you say about people who are interested in medical but maybe have like a different life story?
There's some hard life stories out there, and when I grew up, alcohol was just part of being a kid. My stepfather, the lumberjack, used to come home on weekends, and he would get up when he was working in the woods. He was a hard worker, and he would wake up at 4 o'clock in the morning, and when the sun came up, he'd be starting his chainsaw, and he'd saw till 4:30 or 5 o'clock in the afternoon, and he was in bed by 7 o'clock, whether it was midsummer or February. And he would come home on weekends and wake up at 4:30, and we didn't wake up. It was Saturday. We woke up when Bugs Bunny was on, which was 9 a.m. And so, we didn't have any reason to be up before that. But by then he would be drunk, and he would drink coffee, and then he would switch to beer, and you smoke, roll your own cigarettes, and there would be just a haze in the whole house. It would just spread, and it just like a cloud of smoke, but it would be just 8 inches deep, and you could tell he hadn't moved. And he was, when he woke up, because we woke up at 8:45, he was already mad. And then on weekends, my grandparents would come up from the cities, and my mom's sister, my aunt, and my uncle, Pumpkin, they would, everybody would get drunk. And, you know, as a 4-year-old kid, you learn to pretend to be sleeping. So, you know, a drunken aunt wouldn't slobber on you and say, you know, who you love best, and, you know, just drunk stuff. And it's not an environment. My mom bought me books, and she bought encyclopedias, and she bought a whole, in 1969, she bought the entire Encyclopedia Britannica set, and she had to make payments on them. And a salesman came to the house, and she bought them, and then she would get the yearbook updates. And we, as kids, read those things cover to cover. And Carl, my stepfather, was mad because she spent $600 on books, and which was a lot of money. And and he said, well, why did you buy those books? You got the dumbest damn kids in the county. And you know, said it out loud when you're smoking a cigarette. And you know, those kind of things stick with you. And my brother pulled a lamp on my head. I was holding him in a rocking chair, and he grabbed hold of the cord and pulled the lamp down, and I got 6 stitches in my forehead. And the doctor that was the only doctor around, I think it was not during clinic hours that happened, so he was mad. And he used anesthetic, but he used it like he was just sticking that needle all over the place. And not once did he ever, and you know, we see him for shots and whatever else. I think he'd like giving shots. And not once did anybody ever ask if I would think about medical school or think about any kind of things like that. And it seemed, I mean, it certainly seemed out of reach. When I went to medical school, when I finally got in medical school, and even when I started aiming that way, I think there was a lot of skepticism. And I was drinking when I was 12 years old. I drank with my uncle, and I drank with Edwin Peterson, the one who died feeding his hogs. We used to go fishing in the middle of winter, way out on the ice, and spearing northerns, that was legal. But you know, like I said, we used to shine deer at night, and it was just feeding our families. And when I was in high school, my high school counselor, they talked to everybody, and he called me into his office when he was in 11th grade, and when I was in 11th grade, and he pretty much just flat out told me that I wasn't college material, and that I should think about going to tech school because I'd be good with my hands and building transmissions and stuff. And I totally believed him. And then we had a fill-in counselor that came in my 12th grade year, LeAnn, and him and his wife Norma loaded me into their car on a Tuesday, and we spent the entire day, a school day, drove to Duluth and went through UMD, biggest building I'd ever been in, lecture halls and the Tweed Museum. And he said, you could go here. And I believed him. And I did. And I wasn't good at it initially. But, you know, there are some, you know, I can name names, and there are people who flat out saved me. I was lost. And I mean, I was at UMD, but I was signing up for classes. And it was in the gymnasium. There was it's a gymnasium. And there was lines of 200 students, and the instructor with a card catalog at a table. And then they would sign up. They would take a card out, and you'd put your name on it, and they'd get into the class. And I was so far behind in the lines that by the time I got, you know, 20 people away from the table, the class would be full, and they'd put up a sign that's full, and everybody would run to their next choice. And I didn't have a next choice. And I would go to another line, and the same thing would happen. And Jay Newcomb was a native instructor, and he's taught some American Indian Studies classes. And he was watching me, and he knew me for what I was, you know, this lost Indian kid. And finally, he came and he got me, and he said, tell you what you're going to do. Let's sign you up for my classes. And in the first week, people will drop out of the classes that you want, and you can get into those classes. We'll get you a spot into those classes. And I mean, it seemed like such a simple thing to do, but it was such a big thing. And I had this green duffel bag that somebody went to beat Vietnam. And when he came back from the war, he was angry. And the editor of an underground newspaper in San Francisco, but he gave me his duffel bag. And I carried that duffel bag everywhere. And I had that green duffel bag full of everything I owned. And Jay Newcomb was the instructor. And so he signed up for his classes. And then he said, where are you staying? And I had to admit, I didn't really plan that far ahead. I didn't have a place to stay. And he said, why don't you stay with me and my family for a couple of weeks until you can get situated? And I stayed with him for 2 years. And, it's incredible that people do that for each other. And to answer LeAnn's question, finally, I know that medical school isn't necessarily an option for a lot of people. Not that it isn't an option, but it doesn't present it as an option. And the physicians do get a lot of respect, and they do have a lot of power. And power is a thing that doesn't sit easy with traditional Native people, because that's not the way our communities are traditionally. Nobody has that much power over anybody else, and income and all that stuff that comes with it. But I used to talk to, I've been there for 26 years on Fond du Lac, and I used to talk to kids when they were 15 or 16 about going to medical school, and I didn't get a lot of takers. I've had some students that have gone to medical school, but now I switched to younger, and younger means I was talking to 4-year-olds about medical school, and I still do. And I talk to 15-year-olds, and I talk to 4-year-olds, and if somebody's in the 11th grade, I want them to tell me what their plans are. And sometimes they don't have plans, but I plan to at least, you should think about that. And even if those plans include trade school or plumbing or welding or sheet metal work, those are good jobs. And I'll support anybody that I'll do whatever I can. I had a young 9th grade student that wanted to be a veterinarian, and I didn't know the veterinarian, but I called and I said, I have this student who wants to be a vet. And she started going there and built a relationship off of a really easy to make phone call that would have been difficult for her. It just would have been difficult. It would have been difficult for me to do that when I was younger, and to believe in myself enough to make a call like that. So now, if I deliver a baby, brand spanking new baby, by the time they go home, by day 48 to 72 hours, whatever, if it's a vaginal birth, it's 24 to 48 hours, and if it's a C-section, it's more than 72 hours they get sent home. But I talk to those babies about medical school, and I talk to the babies directly about medical school, and I give them tobacco. And when they come in for visits, I call them doctor, and I've had parents leave the exam room, holding a baby and holding him so close, and just so excited and saying, you're going to medical school. And for me to talk to parents would be one thing, but I don't believe in talking down to kids. And if a 3 or a 4-year-old comes in with an ear infection, I bring out the big anatomic flip chart. All the med students that come and work with me know where that is, and all I have to say is go get the book. And they come back in, and they'll have it flipped open to the page that matters. If it's if it's an eye or an ear anatomy or whatever, and we go through the anatomy and where their infection is, where the fluid is, what drains it, what caused it. And those kids listen. I had a 6-year-old kid that came in that was looking at a kid's ear it's tricky business. You use a speculum, you use a little funnel, a little plastic funnel, and it's not sharp, but it's pokey. And if you stick that thing in a kid's ear, then they squirm. They don't like that in their ear, and they squirm, and that thing stabs them inside of the ear canal. Nobody will ever look in that ear again. And so I have med students. When I hold the speculum, I hold it. When I hold that otoscope, I brace it off this. I hold it like that. So if they move their head, that whole thing moves, and they can't get poked in the ear canal. And so that way I can see in there. But the other thing I do is I tell. I've seen people make buzzing noises and baby talk and all kinds of stuff. And what I say is, you are a good boy. You are a good girl, or just, you are so good and you're so big. And they live up to it. They live up to that expectation. And I always get to look in ears. And sometimes they don't. Sometimes some kids just won't allow it. But most of the time I get to do that. And one time, on a 6-year-old, I looked in his ears, and I was looking in his ear, and I said, you are a good boy. And not only did I get to look in his ear, but he started crying because nobody told him that. And that was one of those things that made me realize that the things we say to people have power. And the things that I say to people as a physician, I can get on a soapbox that I would feel ridiculous being on otherwise. But, when I'm in an exam room, with a kid with an ear infection, and, or a kid with depression, or, somebody who's just lost their way, the words that I use with them make a difference. And I know that. And all of us really have that power. But I've been put in a position that that I never, back when I was in Bear River growing up and drinking and driving fast and shining deer and all other stuff before I went to college. If somebody would have said that I was going to medical school, I would have been, nobody would have believed it, but the least of them would have been me. And it's such a, it's a privilege. And I want people to know that. And I want people to know that I'm happy being a physician, and I'm happy with my role in the community. And that, that humbling statement that I made at the beginning of things, it is true. I want people to know that they can approach me, as a mentor, as a person. I diagnosed tennis elbow, lateral epicondylitis on somebody. I was waiting for Ivy to come out of AICHO so he could go to a lunch or something. And while I was there waiting for her, somebody came up and stuck his elbow in the window and said, "Hey, doc, it hurts when I do this." And the old joke, don't do that. But I diagnosed him with lateral epicondylitis and gave him some things he could do and what he needed to do next. And it's a privilege. And I want students to know that when medical students come and work with me, they are so bright and they're so on fire for stuff, and they're so eager to do things, and they're so happy to be doing patient care and not just sitting in a classroom looking at pictures of ears, but actually being able to look at an ear themselves and have the conversations. And, to know that, that I teach. The Latin word for doctor is docere, which means to teach. And that's my job. Part of the patient-centered care is access, easy access that people can get in, and that patients participate in their healthcare And and teaching is a big part of that, that they understand what's going on. Medicine is complicated business. And, when you start throwing around words like choledocholithiasis, then, people get lost. And if you say cancer, even if you don't think that, necessarily, you have to be honest with people and you have to explain things. But there's some words that once you spit out, they're hard to take back. And they make people forget everything else, when that might not be the case. I've had done some big, long explanations of things to patients, and it takes more than one time to make it stick. But, it's part of the job, and it's part of the things that I need to do to be better at what I do. So, LeAnn, I don't know if I answered your question at all in the process of that. So, you take another shot.
Of course you. Yeah, no, thank you. I was just thinking, so my dad, he ended up going to the hospital in May, and he's been at 3 different so since May, we're in October, he's been at 3 different hospitals, 3 different ERs, and then 3 different, stays. And then he also has been in 2 different skilled nursing facilities, just this whole time. And he hasn't had one, not from a CNA to a CMA to a RN to a doctor who's been Native, who has provided care. So he's had all non-Native medical or healthcare providers, our physical therapy, occupational therapy, all of it. And but we encountered, as a family, we encountered a lot of healthcare professionals who are they're very kind, they're very caring, they're very smart. And and he has had excellent care. But I'm curious about, like, with how does cultural knowledge play into healthcare, like healthcare? Like, how much does it add to it? Like, what difference does it make? What do you see the benefits? And so from having what would be the difference with a Native community member who's a healthcare provider who would bring that knowledge? Also, what could non-Native healthcare providers do to increase their knowledge, or why would that matter? I know that's a long, convoluted question, but in that general direction.
Yeah, and being that I don't answer questions directly anyway, when I started medical school, when I was on the fire department, the fire chief was this little bigoted Texas guy, and he had it out for me, and he hated it that I was the #1 student in most of the classes that we had, firefighter training classes and whatever else, paramedic class. I was the #1 student in almost all those things, and he would find any way he could to bring me down a notch. And he used to have this little cardboard gauge that he carried with him that he'd put on my collar, and it had a certain distance up, and that's where your hair ended. And he would only check my hair and make me get my hair cut. And my hair was short anyway, the firefighter. But he would make sure that he had the power to make me cut my hair. And by the time I got to medical school, I was wondering if I should go, as Ojibwe student, or my assumption was that in 4 years of medical school, that there's so much information that when you come out on the other side, it's like a hay baler, just takes all this stuff and just pounds it, and packs it, and cuts it, and forces it through a thing, and then ties it. And when you get done with 4 years of medical school, you come out and everybody's the same on the other end. And I thought my spiritual beliefs, my Ojibwe beliefs, would get scienced right out of me. And I was so glad that they didn't. And when I applied for medical school, right now I've got braid this thing every morning, but when I applied for medical school, it was that long. My braid had 4 bumps in it, and it stuck straight out. And but it was the start of not hiding who I was, and even in residency, then I had a ponytail, and that would I could tell it. Doctors and medical people are ethical, and they try to look at different populations, and they try to be open-minded, and you know, but we're stuck with the stuff we have inside of us sometimes, and sometimes I could tell that that was an issue, you know, that they didn't want to say something directly against natives, and you know, they'd be real cautious about some things, but sometimes they'd take a shot if they could get away with it. And as an intern, you know, when I first started in the hospital, we went rock, paper, scissors. So my very first night of residency, and I was in a surgery service with 33 patients in a busy service, and it was crazy. And there was 6 of us on the team, and the 3rd and 4th year residents were in charge. And at the end of the day, we'd done everything. And they said, okay, somebody's got to stay on call. Somebody stays in the hospital overnight, manages all the floor patients, manages pain, manages fluids, manages whatever. Labs come in that are bad. Somebody comes into the ER, you got to admit, you know, whatever happened, somebody had to be that person. And we went rock, paper, scissors. And Ivy knows rock never fails me, but it failed me that time. And on a rock, paper, scissors, I ended up as the resident, the only one in the hospital on my very first night of residency. And it was 2 o'clock in the morning, and there was no sleep, and I was running up and down the stairs all night, emergency room to the surgery floor. And then I had just all these pagers. I had the emergency room pager, I had the surgery pager, I had the family practice pager. And they were just blinking all the time. They were going off. And in Seattle, the stairwells, they have windows, but there's no glass in them because it doesn't get 40 below. And I was running back up to the surgery floor for the 4th time. And it was 2 o'clock in the morning. Somebody came into the emergency room. My emergency room pager went off. And I hadn't even gotten to the floor yet. And I had to go to the emergency room. But I remember looking out that window and thinking, I know why people jump out of windows. And, you know, and as a native physician, I've had patients when I was a medical student that, you know, one of them, my entire interaction with them was get the hell out of my room. And I never made it back into that one. I had one who was a cab driver who was stabbed multiple times, and we did surgery on him, and we had to put a patch on his heart, and it's amazing. He was so close to the hospital, and things were just right. And but I was in surgery, and the surgery resident, we did a ciliotomy, which means you just split his abdomen just wide open so you can look at everything. You run his entire ball, all 26 feet of it. You're just pulling and looking for cuts and looking for bleeding and looking for whatever things to sew up. And he had a stab wound in his heart, and so he had the sac around his heart, pericardium, was full of blood, so his heart wasn't moving. So you take that sac down, and you don't put it back together. And his spleen he was stabbed in his spleen. 25% of your blood is in your spleen, and that you just took that out, and then ran his entire bowel. He was eating Slim Jims before he cab driver. And there's lacteals, there's these blood vessels on the surface of your intestine, you know, and I had his intestines in my hands, and we're running those intestines, and there you could see these they're not blood vessels, they're clear, and it was grease running in those things. And the chief resident said, "Dr. Vainio, what is that?" I was like, "I'm not sure." He said, "Those are lacteals. That's grease." He said, "That's Slim Jims in there." And it you know, eventually heading for plugging up his arteries. But that 3 o'clock in the morning, I was the one that was in his room, you know, looking at drains and looking at, you know, draining blood, draining serous fluid, draining whatever, you know, looking at those drains. And he woke up, and the kind of sun, the light was just starting to come into the room, and I had my back to him, and I had a white coat on, and I had my stethoscope on, but my ponytail was back there. And he said, "Native?" And I said, "Yeah." And he said, "The guys who stabbed me were Native. I want you out of my room." And I said, I'm the only one here. You know, I didn't do that. And I'm sorry that happened to you. But I'm the only one here. I need to check on your fluids and make sure your blood pressure is okay and your pulse rate is okay. Do you know what happened to you? Do you know where things stand and what? And I went through all the things that were done in surgery with his heart and his spleen and his intestine and all the drains and why they were there. And he was in the hospital for quite a while, weeks. And he had some setbacks and he got a pneumonia. And he finally discharged. And by the time he discharged, I was the one he trusted most. And it was months later. I was walking into the hospital and I could hear brakes squealing. And I looked up and it was a taxi cab. And the window rolled down and it was Dennis. And he's like, "Hey, Dr. Vainio, good to see you." And I said, "It's good to see you, Dennis." You know, those chances don't come to people very often. And I saw somebody last week, an elder who's got cirrhosis, alcoholic cirrhosis. And he quit drinking, but it's too late. His liver shut down. And he looked pretty good. But there's nothing to do to fix him. Everything that happens tips him over into the hospital. And one of these days, he's not going to make it out of there. And we already discussed in his DNRs, do not resuscitate. He won't go on a ventilator. He won't get CPR. When it's time for him to die, he'll die peacefully. Because there's nothing to do. There's nothing to fix. And he's on a whole bunch of meds. And people with liver failure have to take a thing called lactulose, and it makes you have loose stools all the time. People hate it. But it's a thing that keeps if you don't take it, your ammonia level goes up. And if your ammonia level goes up, it's associated with confusion. And people, when they get confused, they don't know they're confused. And then they fight taking all their meds, and then they end up in the hospital for certain. And then, you know, people need meds for agitation, and it's not you know, he's a traditional person, and it's not the stuff that he necessarily wants to be taking. And so Dr. Vainio, at the end of the visit, said, "Dr. Vainio, I have something to tell you." And I was like, "What's that?" And he said, "I've been seeing spirits." I see relatives that I haven't seen since I was little. I'm seeing little people. And sometimes they can be mean. The Western medicine part of me wants to start a medicine on him or send him to some kind of therapy or do something else. The Ojibwe side of me gave him tobacco. And I make my own sema, I make apachos again. I make the tobacco that Wayne gave us. And I give it to patients. I gave it to a 4th grade girl who came in with strep throat. And I asked her, because I ask everybody what she wanted to be. And she wants to be a doctor who takes care of kids. So we took apart the otoscope and we looked at the parts of that thing. And we got the book out and we looked at where her ear infection was and how she looks with that thing. And then I listened to her lungs and I told her we listen in 4 quadrants. I listened to her heart. You have 4 valves in your heart. I'm listening to all of them now. And then I named those valves as we went through. You know, this is where your sigmoid colon is. This is the last part of your intestine. There's a kidney down deep in here. This is your spleen. By the time I got to her spleen, she goes, "That's amazing." And so this is where your stomach and your pancreas are. This is your liver and your gallbladder here. This is here's a kidney in here. There's your appendix here. This is all small intestine stuff. She was in love with that exam. And her mom was so excited that she's going to medical school. Her daughter's going to be a doctor. And I gave that 4-year-old, that 4th grade girl, I gave her tobacco. I said, "Do you do traditional things?" She said, "Some things." She goes, "I go to powwows." I said, "Do you put tobacco out sometimes?" She said, "Yeah, we do. Me and my mom do." And I gave her tobacco and I took a paper towel out of the dispenser and I said, "Here's the fancy carrying case you get for it. But you can put this outside. You can burn it. You can put it in water. You can put it on clean ground. You can hang on to it. This is yours. And yours to decide what to do with. And I want you to know that your strep throat will get better. And I also want you to know that I'm proud of you for wanting to be a doctor. And you're going to be a great doctor someday." I think if I would have heard those words from a physician when I was in 4th grade, you know, I don't know if it would have changed things. I think I still would have been drinking and shining deer and netting fish out of season. But I'd like to think things would have happened sooner. And maybe things didn't need to happen sooner. Maybe they happened exactly the way they're supposed to. But all of us have obstacles. All of us have things that we have to overcome. And some of them seem insurmountable. And sometimes there will be people telling you, "You can't do that. You can't be a doctor." The minute you believe them, they're right. You know, you can be a doctor. You can be a sheet metal worker. You can be whatever you want. We're put here. This is a temporary physical experience for our spirits to get better. This is something our spirits need. And in that process, you know, we're a community and we're here to support each other. Dennis Jones, Pabam Bernice, tells us that at our core, even mean people, even hateful people, you peel off those layers, it's all something that's happened to them to make them that way. You know, at our core is love. And that's what needs to come out. That's what needs to be part of medicine and part of all the things we do and all the things we interact with each other. The basis of that is love. Joanne, it means unconditional love. And it's the kind of love our ancestors have for us and our families have for us. And it's what we should have for each other. You know, when somebody's mean to us or somebody's quiet or somebody's whatever, we don't know what makes them like that. You know, something happened, and maybe they don't want to tell you, and maybe they won't. But they need some understanding, and you need to cut them some slack, and you need to respect them. People know that. Oppressed people always know when somebody is about to do something mean to them, or working on being mean, or just flat out mean. But they can also spot kindness and love and understanding. And it's how we need to be. I think it looks like I went over time here. So, miigwech Bizendali. Thank you for listening to me. Sorry I went over later.
Well, no, thank you. I think we could spend a couple hours here and just have such a great conversation, because what you're sharing with us is so meaningful. And I'm going to be thinking about the things that you've said for some time. I know usually we take a couple questions at the end. If you're willing to stay for maybe just 3 or 4 more minutes, and I'll see if anyone here has a question. If you do, if you want to put it in the chat, and usually Ivy will come on and help with the questions at this time.
I'm here. So I'm going to start with the first question, if that's okay, Dr. Vainio.
Ivy?
I just Googled how many American Indian physicians there are in the United States. And there are approximately 3,400, consisting of 0.4% of the physician workforce. So I can be sure that you are doing everything in your power for the past 26, even 30 years of working with Native youth, going to schools, doing mad science, talking with youth in the clinic room, and encouraging them, talking to babies and giving them tobacco when they're born, and talking to them about medical school. I really feel that you're doing this, and you're gonna, in another 12 years, 20 years, I'm gonna look again, and there's gonna be double that number just from the work that you've done. And the need, can you just tell us about the need for more physicians and what's being done on the state level, or nationally, and what organizations are there that are helping with this?
Well, AAIP, the Association of American Indian Physicians, is really active in this. They have, and the University of Minnesota Duluth Medical School, Dr. Owen is the director of that program there, and she was a past president of AAIP. And she could really answer a lot of the specifics probably better than I could, but there is a push always to get to look for students. And I'm not the only one that's out there looking for students and recruiting right from kindergarten, and making sure that families, because it's not just students, and if you're just going to tell a 4-year-old, sometimes they forget. But if you tell a 4-year-old when a grandmother is with her or a grandfather is with, they don't forget. And all of us want our children and our grandchildren to do well, to do better, to do good work, to support the rest of the community. And so there are some med school programs. Oklahoma is a big one for recruiting students. North Dakota is another med school that recruits students. There's programs in the Southwest, Tucson, and there is a need. I'm going to be talking to nursing programs, and because we need Native nurses, we just need nurses, but it, I have such a good relationship with a lot of my traditional patients, and a lot of tradition, and there's varying degrees of tradition. Some people are very traditional, and sometimes, and you wouldn't know it by looking at them, and sometimes people are not as traditional, and certainly boarding schools and making our ceremonies illegal. Not all government programs worked, but those ones worked like a charm. And so a lot of stuff has to be found again. And but there are people in the communities that are that are so good, and so want to see everybody do better. And that's people like Hope Flanagan from Dream of Wild Health does organic gardening and traditional planting and traditional medicines, and but it's traditional healers and traditional people that just do ceremonies, and or even go to ceremonies, and to be at a ceremony with patients changes our relationship, and it changes it for the better. Yeah, I'm on a big not answering a question thing here, and there is a need for all people to take care of their own people, and that can be ethnicity based, gender based, whatever. If somebody has a healthcare provider who is like them and understands them and understands their traditions and understands their background and where they've come from, it just makes things better. And that's not saying anything bad against non-native providers. I mean, non-native providers have by far taken care of Native people, because there haven't been all those. Peter Talbot at the Seattle Indian Health Board is one of my instructors and one of my mentors and one of my best friends. And he's 78, and his wife keeps telling me, tell him to retire, and I can't. He's an institution, and he's doing what he was put here to do. He's taking care of Native people, but he's not Native. But he is so trusted and so loved that he'll just keep doing that, and he makes a difference, and he knows he makes a difference, and that's a hard thing to stop doing. So when I see med students, I always make sure that med students know that I give tobacco to patients. I give tobacco to med students. We talk about traditional things. We talk about love, and we talk about forgiveness, and we talk about things that you don't have a formula to calculate somebody's corrected sodium level when their glucose is 1100. There's a part of medicine that's a big part of it that is based on it's based on showing them, it's based on love. And man, that diverted from the question, I just realized. So we're always looking. That's the answer.
All right, thank you, Arne. Miigwech. You have a comment from Madonna. Miigwech for all your time and efforts to help youth. My 4-year-old grandson Fletcher is enjoying the stethoscope given at the Science and Medicine Fair. Yes, Minobamadazi. That was a beautiful event that had a lot of local, native, and indigenous, and BIPOC physicians and nurses and healthcare providers, and just all that important connections being made one-to-one, and having that access. And yeah, I don't know if it was Fletcher or not, but that when Arne taught that one kid to take his blood, do the blood pressure check, he was so into it. Like for like an hour after that, he was like going up, taking a stethoscope up to everybody. And that's just so powerful and so heartwarming to see Native kids be that into that, you know, and for them to see people that look like them in these positions. And so I don't know if that was Fletcher or not, but we've seen quite a bit of that day. And yeah, so I'm glad that you went to that, Madonna. If there's any other questions, we could take one more question. I know we're a little over time. Dr. Vainio likes to storytell, and every word is just amazing. And so if you have a question, anybody going once, going twice? All right, LeAnn, you want to end us out?
I do. I'm just trying to come on camera here. I just want to say miigwech so much for being here tonight with us, Dr. Vainio, and taking time. I 4 years ago, I was like, it would be so great if we had a speaker series, and you were the first person that came to mind, you know, to talk about Indigenous health and talk about our community and talk about what we can do moving forward to be a healthy community. So I just want to say thank you so much for being here tonight, and I look forward to hearing more in the future. And I really look forward to seeing all those little babies and those little kids become doctors, and to become a doctor like you. So I just want to say thank you, and thank you everyone for your time tonight and being here with us. Miigwech.
Miigwech, Dr. Vainio. Good night.